Hello, my name is Dr. Mauro Zappaterra, and I am the medical director of our functional restoration program here at Synovation Medical Group. Today we have with us a patient who has just recently completed the functional restoration program. And what I wanted to do today is ask the patient a few questions about his personal experience of going through the program so that we can get a personal take of what it is like to go through our functional restoration program. Thank you very much for coming today.
You're welcome.
So could you describe what it was like for you to go through the functional restoration program and help define it from your perspective?
Thank you, Dr. Zappaterra. I'd be glad to do that. It was a great experience. And the FRP, in my opinion, provided a cohort group with several things. It provided us with a physical therapist, it provided us with a psychologist, and with you as the medical doctor with 3 different perspectives during the time I was here with my cohort. The physical therapy sessions were provided for us by an excellent, very competent physical therapist that's on your staff. She provided us, first of all, with general exercises that strengthened everybody in the group. And then she also focused on specific exercises that were designed for each one of us to strengthen the specific areas of our injuries that we needed help with personally. And true to her profession, and I have worked with a number of physical therapists in the past and before I retired, she would not let us skate on anything. And so she would show us how to do the general exercises, and then she would teach each one of us the specific ones she knew we needed for our particular injuries and body damage. And she was extremely competent in how she showed us to do those. Further, she found an app that was brand new, and I believe I was the first patient that she said, "Oh, I want to try this." And so she loaded several of the specific exercises for me. She put both verbal and video demonstrations of those. She sent them to my email. I downloaded them. I put them on my own computer, and then I looked at them. My wife also looked at them, and then the next day when I came back, I told her that I could see them and they were great, so I could also do them at home after the cohort was done, which was very helpful. The second was our psychologist, a very skilled man. He provided us with also several sessions a week when we met with him. He provided us with teaching on how to address such things as interpersonal relationships, dealing with pain by reframing it in how we view it. He also explained how to be more assertive on a day-to-day basis with challenging relationships. He also provided us with several tools that we might consider learning in order to deal with what we're dealing with in our personal lives. One example was how to understand and differentiate between thoughts or feelings and facts, because the first 2 are not facts. And so he was very helpful in those. He also talked to us about how to deal with our emotional state of mind, stress, and help make good decisions. One of the very helpful handouts he gave us was one entitled "Know Your Specific Opioid Risks." And we all know that there's a real problem with opioid addiction and overuse today. And so that was a very helpful handout that he provided for all of us. The third was you and the information you provided us. And we met with you also several times a week, as you know. When we met with you, you had several sessions, one on reflective self-reflection and meditation. You provided us on how to eat and plan healthy meals. You also provided some specific coaching on label reading. My wife and I are avid label readers anyway when we go grocery shopping, but you helped open our eyes even more. I'd go home and tell my wife, "Man, Dr. Zappaterra showed us this or that," and I'm especially keen on several different things. One of them is I'm on a low salt diet, which means 2 milligrams of salt a day. And so on this one particular day, breakfast foods and snacks were brought into the group. And so I was very keen on seeing what 2 milligrams of salt looked like. You brought in a scale that was very sensitive, but you also brought in a 1 cup measure. And so I watched as you trickled in 2 milligrams of salt, and I said, "That's 2 milligrams?" And you said, "Yep." And I said, "Oh boy," or I thought to myself. And then we continued to look at the breakfast foods. You showed us fruit juices, and the companies tell us exactly what percentage is real fruit. I was amazed at some of those things that were called fruit juices and how much or little was actually fruit juice. But the one that absolutely blew me away was when you brought out one of America's favorite sodas. And according to its own label, it said there are 16 grams of added sugar. So you took the cup and you began to take teaspoons of sugar. And all of us in our cohort began to watch, and you started putting teaspoons of sugar in that cup. And I think we all took pictures. I know I have some at home. And when you got to the 16-gram level, we said, is that it? And you said, yeah. And it turned out to be 1/3 of a cup of sugar in that 20-ounce bottle of a soda, one of America's favorites. And I had heard that, and I'd seen some previous demonstrations where they just put it in a pile on the table, but seeing it meet the full 1/3 measure was just astounding to me. So we were taught and given tools to use to help with our own personal issues related to injury and pain. How to put them into perspective, how to refocus them, reframe them in order to handle them. But I also have some conclusions that I thought might be helpful about the functional restoration program and the excellence it provided me in dealing with my ongoing pain issues. First of all, it was excellent and well-trained specialists in all 3 of these disciplines that provided us with input, with handouts, with materials, and helpful information to deal with our pain, and in cases, handle it and move our perspective on what that pain was doing and how to reflect, meditate, and do other things to help deal with it on a daily basis, which I have to do. Another thought is that it helped us addressing the pain that each of us has and understand the pain the others in the cohort had. And I recognize that I am very blessed to be able to be part of the group because I don't think I have nearly as much to complain about as the others that were in that group. Another thought is I was offered tools to continue to work on myself at home. And so I have some things on a daily regimen that I work on and continue to try to deal with, and the specialists I'm still dealing with in my pain and suffering to try to find a solution to what I've been through. Another thing is that I know that this is not a quick fix. I've been at this for a while trying to resolve my injuries. And so I'm going to have to continue to use the disciplines that have been offered and provided. The manual that you gave us is very helpful. There's detailed information about exercises, about a lot of what each of you talked about that we can use and we can read and we can draw on. My name is Terry. It was a privilege to be part of the FRP that was just concluded, and I would encourage you to contact the Synovation Medical Group and find out more about it if you're suffering from pain and you think there's no solution. Thank you very much for listening.